Good evening, everyone, and welcome to Surviving Dental School, Overcoming Stress, Burnout, and Depression, a webinar presented by the American Student Dental Association. We'll start in just a moment after some instructions and introductions. My name is Kasia Halko, and I'm the facilitator of tonight's program. I'm ASDA's marketing manager and one of 14 full-time staff that work for ASDA. Tonight's presenter is Dr. Michael F. Myers. This webinar is a presentation of ASDA's Wellness Initiative, which began in 2014 following the tragic death of ASDA past president Juan Lee. The goal of the initiative is to equip ASDA members with a variety of resources related to overall wellness, including 5 dimensions in particular: emotional, physical, environmental, occupational, and intellectual. You'll find resources for each of these, as well as the links to wellness centers at your respective dental schools on ASDA's website. This September, ASDA is also celebrating Wellness Month, where members and chapters put a special focus on dental student wellness. 3 previous webinars that have already taken place this month are available as recordings on ASDA's YouTube channel, and I encourage you to take a look at those. At this time, I'd like to recognize the exclusive sponsor of ASDA's Wellness Initiative. Great West Financial, on behalf of the ADA student members insurance plans, is committed to helping you stay healthy so you can achieve your career and life goals. At the same time, they want to give you the peace of mind of knowing that if anything ever did happen, injury, illness, or worse, you and your family can have some financial protection. That's why they offer ADA-sponsored disability and life insurance at no cost to ADA student members while you're in dental school. You can request the insurance at bringhealthyon.com. At this site, you'll also find lots of health tips and a sign-up page to receive health-related emails. Now I'd like to introduce tonight's presenter. Dr. Michael F. Myers is Professor of Clinical Psychiatry at SUNY Downstate Medical Center in Brooklyn, New York. He's the immediate past Vice Chair of Education and Director of Training in the Department of Psychiatry and Behavioral Sciences. He's the author or co-author of 8 books and more than 150 articles, book chapters, letters, book reviews, and 8 videotapes covering a range of topics in psychiatry. His 2 most recent books are Why Physicians Die by Suicide: Lessons Learned from Their Families and Others Who Cared, and The Physician as Patient, a clinical handbook for mental health professionals, co-authored with Dr. Glenn Gabbard. Please join me now in welcoming Dr. Michael Myers.
Hello, everybody. Hi. I'm just getting set up here. First of all, I would like to thank Kasia for inviting me to do this webinar. This is a great honor for me to do this, and I'd like to welcome all of you to the webinar tonight. And for those of you who can't be here but will watch this online, I hope that this is a good educational opportunity for you. Okay, so let's get started. And by the way, as I'm going along with this, I would urge you to be kind of thinking of questions, because there should be plenty of time at the end for you to pose those questions, and I'm quite happy to answer them as to the best of my ability. So here are the learning objectives for tonight. I want you to come away having a sort of sense of what you would look for in yourself if you're not feeling well. I'll touch on burnout and depression in yourself as well as others, things that you can do when and if you're not feeling well to take care of that. Most important, I want you to learn strategies to reaching out to colleagues and peers who aren't feeling well, and I'll explain why I feel so strongly about that in a few minutes. And also, we're going to kind of finish off toward the end with a short videotape as to how to reach out to somebody who might be suicidal, what not to say and what to say. Okay, let's start with stress. I'm doing this in a very sort of informal way so that you'll just sort of get a sense of without all of the science. I always tell people, you're the best judge of your own feeling state. If you feel stressed, then exactly that's what's going on. So you have this inner sense, and it's different in lots of different people. Okay, so I listed a bunch of things on this slide. You'll feel tense, on edge, et cetera, physiologically kind of revved up as if your adrenaline is going, and tearing up, that you find yourself close to tears a lot. You feel on a treadmill, that you're just go, go, go. Multitasking, which we take for granted, and we do that so much in our everyday lives, we can't do it as well when we're stressed. We make silly mistakes, or we forget to do things. We may need to write things down. You feel kind of, you got a lot in your mind, and you feel tuned out, not sleeping well, you're tired. And I mentioned here about alcohol, that either whatever your usual use of alcohol might be, you find, I think I'm drinking a bit more than usual, or you find, I used to notice if I had had one glass of wine or one beer or whatever, but I don't notice now until I've had 2 or 3. So that's an important thing to note. What about other things? Some of us don't always actually feel stress in a sort of subjective emotional way, but we get physical symptoms. And those are some of the things that you can get, that you just find yourself, feeling you've got headaches, or your stomach's bothering you, or gastrointestinal difficulties, trouble with your back, muscle tension, things like that. So it's your body that's showing your symptoms of stress, changing your appetite, and that you don't eat as healthily, you skip meals, you're not as relaxed, not as friendly, overall not a very happy camper, and you look forward to each day coming to an end. Now that's all I'm going to say about stress, because as I say, it's just kind of a general thing, and in many situations too, it just goes away, because we're able to, we think it's, I think I'm stressed because of this particular exam coming up, or I'm stressed because I'm having trouble with my boyfriend or girlfriend, or I'm feeling stressed because I'm worried about finance or something like that. As I said, it often goes away. Okay, so let me move it now into burnout. As you probably know, it's all over the lay press and in the medical and dental literature that so many students studying today are struggling with burnout. Okay, and I think I'm not exactly sure about some of what I've looked at in the dental research, but I think it's roughly the same as in medicine, and the ballpark figure is about 50%. Now, by the way, those are based on questionnaire surveys. They're anonymous. We're not sure exactly about the methodology, but in my mind, it doesn't matter. I think for just even a sizable cohort of students to feel burned out is not good, okay? So what is it? This guy Freudenberger, and this is about 30 years ago, coined this as occupational exhaustion in those in the helping professions. So that's the first thing, that this has got to do with your career. And that second bullet is important because you get disillusioned. You're kind of devoted to what you're doing, and you just find that I'm just disappointed. This is not really turning my crank or whatever as I thought it once would. And the fatigue that you feel is not just tiredness. That third bullet, it's an erosion of the soul in people with ideals and commitment. And that's the part that will really get to you, because you think, this isn't right. I've kind of lost my mojo for dentistry. I don't know, I don't know why that is, that sort of thing. So that gives you a sense that you might actually be burning out with, with the stress of your work. And by the way, this is an occupational definition. It's not got to do with your personal life. It's got to do with your professional life. Yes, you could take a vacation. You may feel a bit better, but it just comes back. It's got all of those dimensions to it. I won't go into all those kinds of details, but a lot of it is like those stress symptoms that I just explained in the earlier slides. DSM-5, that's our current one. Many of you may know about DSM. That's basically our diagnostic code in psychiatry. V codes are the milder things. So you could get burnout with something else, a situational problem, an adjustment disorder. But look at the other ones, and I'm going to talk about most of these as we go along. Major depression, panic disorder, phobias, substance use disorders. And so it's kind of, it's kind of a mixture of things sometimes. And in fact, one of the most common phone calls I would get when I was in private practice from somebody wanting to come to see me would say, "Hey, Dr. Myers, my name is Dr. Brown. I've been feeling kind of burned out the last few months, and but I can't tell whether or not I might actually be clinically depressed, and I can't sort it out. So could I come to see you? Is that something you could help me with?" And I say, "Absolutely. You know, that's what I'm here for," or whatever, and I set up an appointment. And then, you know, as a trained professional, I'm able to sort that out with the individual. Okay, so here's at least 3 of the things. Emotional depletion. You just don't feel the same kind of emotion associated with your work as you once did. And you feel like you have nothing left to give, especially if you've got, say, a difficult patient, that you find that you just kind of roll your eyes thinking that, oh, I can't deal with this person's angst or whatever right now. Detachment. So that's the next thing, that you don't have the same empathy or compassion that you normally do for patients, especially in your work, the ones who are anxious, for instance, about your dental work or about the anesthetic or something. And the low personal achievement is, despite the fact that maybe you're doing okay in school and advancing, it doesn't seem to make you feel any better. You just don't feel that good about really, you know, how you're progressing in dental school. So that's what I mean. It just gives you a sort of sense, I wonder if I might be burned out. So there's the occupational piece. And look at that last bullet, when job stress is high. So this could happen in you if you've got really very busy rotations or something, a lot of exams coming, you got research projects maybe on the go, or a lot of stuff going on, you know, in your personal life. And then personal autonomy is low. And that's very important. We use the term personal autonomy, but also personal agency. And basically, personal agency is a psychological term meaning that you've got some control. And when you feel, especially as a student, if you don't feel you've got a lot of control, that's why you could also get feeling burned out. So, because it's not just about hard work, because people in the health professions are used to hard work. And if it's sort of like good hard work, yeah, so that's all part of becoming, you know, a professional. So you just accept that. Sure, you're tired, but you don't feel burned out. It's when you feel you don't have a voice, you don't have any say in anything, that you know that everything's sort of being done to you or something like that. That's a sort of sense of feeling powerless with burnout. Okay. On the left is what we strive for. Look at the pieces of that pie. There's 10 different facets to that. If we're leading a balanced life, and if all of that looked like that, we would be pretty happy campers. But unfortunately, when you look to the right, you see the imbalance. This was made for medical trainees, but it would certainly apply to you people in dentistry as well. So you can see how much is scrunched up in about a third, and 2/3 is really occupied with your work. So you can see that the rest of your life is really quite out of balance. Now, let me move on, because I want to talk about major depression. That's the technical term, by the way, major depression or major depressive disorder in DSM-5. So over on the left, when you're depressed, it's not normal, and those are some of the things you're wondering. Well, maybe I'm just being lazy, I'm weak, I'm stressed, I'm unhappy, burnout. You see below, though depression makes someone feel lazy, weak, stressed, unhappy, but may be associated with burnout. So you can get those symptoms, but over to the right is really what major depression is. And in the next few slides, you'll actually see that in more detail. We think of major depression as what's called a biopsychosocial illness. So meaning that we look for biological factors in somebody who might be our patient in psychiatry with depression, but we also look for the psychological stresses in his or her life and the so-called social stresses as well, all of which could be coming together and making this individual feel depressed. So look at those bullets: mental anguish and physical pain, severe impairment, so that's much more severe than the earlier slides, and potentially fatal. And it can be, and fatal because of suicide, of course. But I got to tell you, though, I have looked after severely depressed patients before in my practice who haven't been suicidal, but they feel so poorly that they've asked me, Dr. Myers, can you actually die of depression? Because I actually feel that I'm dying. And so that gives you a sense of what an awful kind of illness this can be. And any of you who are on this webinar tonight, or any of you who will view this in the future and have had major depression yourself and are now well, or if you're in the midst of it, you will know exactly what I'm talking about, because it's very different than just feeling a bit down. People will say that this is such an illness that I had no idea. It feels like a medical illness. Okay, I'm going to tell you more about it, but I want to make a point about this. Why though is depression? It's a bit more common in medical students, and as far as I know from the research, it's a bit more common in dental students and dentists as well. Well, the first point I want to make is that we're human too, and depression is a very common illness. And you may think that's a little bit silly, but there's a tendency for us in the professions to feel that we're kind of immune to things, and that we don't suffer from the things that our patients suffer from. But as you know, that's really an illusion. We are, human too. I'm sorry about that. Wounded healer notion. Many of you may have heard of this term before, wounded healer. Basically what it refers to are individuals in the health professions who are there because they've had things in their childhood when they've been growing up that has attracted them to the field of dentistry, say, or medicine, or whatever, and they want to help others. Maybe they've been little helpers, actually, while they've been growing up, or they found that people they're interested in the health professions. So these are individuals that sometimes they really make the best dentists and physicians because they're compassionate, they really care about people, but they could also be vulnerable because of their history and stuff they've suffered while growing up. Genetic loading, what we look for there is to see if there's anybody in the family who might also have a history of depression going back 1 or 2 or 3 generations, and what that was like for them, whether or not they had treatment for it, whether or not they might even have been hospitalized, what that treatment was, or or did they die of suicide, that sort of thing. So that's why we ask those kinds of questions. Perfectionism is a risk factor for depression. As you probably know, perfectionism is a bit of a double-edged sword for us in the health field, because of the fact that it gets us where we are, but yet it can work against us. Like, in other words, as you know, getting into dental school is not easy. It's very competitive. It's not a cakewalk. And also, the standards are high, so you have to be somewhat perfectionistic. But when it's a problem, though, if it becomes what I would call hypertrophied, in other words, students have a lot of difficulty cutting themselves slack. They can't see that this is sort of good enough, and you can't maybe be at the top with everything, that sort of thing. So that's really something that's very important to think about, and to realize that, yes, you have to be good, you have to be safe, but you may, if your perfectionism is capital P instead of small p, that could be a problem for you. Expectations and demands of dental training, and again, they are somewhat high because you have to do well. But if you're on a particular rotation or service where your supervisor or whatever seems to be over the top or something, that can be really hard on you, trying to attain that kind of level of expertise or improvement. Okay, the next 2 or 3 slides are what you should do, though, if you develop 5 or more of the following symptoms. They last more than 2 weeks. By the way, 2 weeks is not a very long time, but let me tell you, if you've got 5 or more of these things and they're going on for 2 weeks, you're not going to feel well. So it can seem like a very long 2 weeks. A depressed mood every day where you feel down. There's really not much let up in that. You may have some variation a little bit. Sometimes people say, well, I wake up feeling really, really blue, My mood gets a little bit better as the day goes on, but then I crash again in the evening, or sometimes the other way around. I wake up feeling great, but by afternoon and evening, I'm really low, that sort of stuff. So it's there every day. This loss of interest and pleasure, that's what we mean by anhedonia. The things that usually interest you and excite you just don't seem to. Relationships, food, your work, things like that. Nothing really seems to please you anymore. And you're puzzled by this loss of interest. The change of appetite, weight loss or weight gain from either, losing your appetite or overeating, putting on weight. Change in sleep can be one of three forms, or maybe all three of them: trouble falling asleep, trouble staying asleep, or what we call early morning wakening. You're waking, bolt awake at 4 in the morning and can't get back to sleep. Sleep changes are what we call vegetative symptoms of depression, and they're very, very important because they can really you get run down very quickly. Psychomotor, agitation or retardation, the yin and the yang. Either you feel quite restless, you just notice that you're kind of pacing, or you develop sort of, some movement sort of your arms or legs or whatever, or the other way around, you're quite slowed and you don't seem to move. You just kind of sit or stare or whatever. Your system seems slowed down. This last one on this slide, the loss of energy and fatigue, that's very profound. And what I want to tell you, especially because most of you would be young people, what I hear so often from young people with depression, they say, it's like, I feel like I must have hypothyroidism, or I must have anemia, or Epstein-Barr, chronic fatigue syndrome, something like that, or whatever. I feel like I'm 80 years old. I feel like I'm walking through molasses. I feel like, I'm walking through cement or something. So it's very, very real and very serious. And there's three more. A feeling of worthlessness or excessive guilt. The worthlessness is that you just don't feel good about yourself. You don't feel you have any value. Some of you may develop a feeling of fraudulence, that I'm an imposter, that I think they made a mistake letting me into dental school. I don't really belong here. Everybody else seems okay, but I'm kind of a bit of a misfit. So you can see that's pretty negative thinking, and that's what you get with depression. Or excessive guilt. You just feel that you're guilty for everything, and even it seems odd to you. Certainly people around you will know, because you just feel so guilty about so many things. The next one, you can't concentrate. So it's more than the other earlier when you just stressed. You really can't concentrate. I've had patients with depression before think that they have early Alzheimer's, because they just say that their memory's gone. They can't concentrate. They can't think. They can't make decisions, etc. And then death, thoughts of death, meaning all the way from wishing you were dead, or wishing you would get run over by a bus, or thoughts of suicide, where you're actually talking about or thinking about ending your life. And we're going to go into that in a little bit more detail in a few minutes. Okay, so what do? You go to there's many things you can do. One option would be go to your primary care professional, and that individual will do a complete assessment. And by the way, sometimes when we're feeling depressed, we're not able to kind of give the most accurate history of what's going on with us. And anybody who's actually in a relationship, I have found that if they come with their spouse or partner or a family member, or even a good friend who knows them well, it can be very helpful, because we get what's called collaborative information. They can tell us too what they've noticed in the person, the changes. That person will make a diagnosis of just treatment. Sometimes it's medication, especially if it's quite severe, because that will really help the neurotransmitter part, the biological part of the treatment, and then psychotherapy, which is absolutely essential. You can't have one without the other. And many people don't need medication. They will respond to good psychotherapy. And those are just some of the kinds of psychotherapy. Your primary care physician may make a referral to a psychiatrist. And if that's an individual, then we'll take over everything. And the medication, I meant. And then a psychologist or a licensed certified or clinical social worker will do the psychotherapy. So that would be like that. Let me just get back to the way this illness, though, can affect your work and studies. Remember I mentioned concentration, memory, thinking, okay, there's all of that. Your confidence goes. And I always tell people, don't drink or use other drugs at all when you're feeling depressed. First of all, alcohol is a depressant, and it's just going to make you feel worse, even though it's tempting to have a drink because it'll take the edge off things. But after one drink, you can really plummet. And in fact, many people will say, I'm not drinking at all. I tried a half a bottle of beer last Friday night, and I just felt awful. So it's good to stay away from alcohol and other drugs, including marijuana. The other dangerous thing is that you can get disinhibited, and suicidal thoughts can come in a surge, and that, of course, can be very, very dangerous. Or you can get irritable, you can withdraw, you can isolate, and that's when it's not good, and you could actually harm yourself. So that's why it's really important to stay away from drugs and alcohol. Now, the good news is that we know a lot about the treatment of dental students, medical students, dentists, physicians, and their level of resilience. Overall, dental students have very good levels of resilience. But when something like this is happening, well, obviously your resilience is challenged. But basically, you respond nicely to the conventional treatments that we have today and regain what's called their premorbid level of function. I always like to tell students that because you don't realize that this is a treatable illness always. And even if you have to take a bit of time away from your dental studies, it doesn't mean that that's going to sink your career at all. It's the rare student who is not able to return because their depression is so nasty, so chronic, or so recurrent or whatever that they can't resume studies or remain in dental school. But that is very, very rare. The vast majority get well, they get treated, they get monitored, and they're back at school and they're fine and have a great career, et cetera, et cetera. Let me switch quickly to anxiety disorders because I want to tell you a little bit about those because those are things too that that you can just feel anxious. GAD is generalized anxiety disorder, so you're kind of feeling anxious sort of all over. Post-traumatic stress disorder, you may have had something that has been traumatic for you. Could be physical assault, sexual assault, exposure to something. If you served at all in the military, you might have that kind of a history. Things might have happened to you when you're a child, et cetera, et cetera. Social anxiety disorder is basically what it is. We used to call it social phobia. And how it could manifest itself in dental students is if you're being observed, say with a procedure, and your preceptor is watching this, or you've got other students watching you do the procedure, and it's like performance anxiety. Now, normally we're all a little bit nervous with that, but if this becomes paralyzing, or you just can't do it, that could mean that you're developing what we call social anxiety disorder. All of these things can be treated. OCD, compulsive, washing, counting in your mind, things like that. I won't go over all of these because maybe there'll be some questions later. They could just arise de novo, meaning that you've never had them before and occur in dental school, or you actually did have something like this earlier, maybe in high school or in college, at university, but got treatment and they're fine, but now it's come back in dental school. Okay, so the best treatment is this combination of usually cognitive behavior therapy is very good for anxiety disorders and or medication. And those are the ones that can be tried. The SSRIs, as you probably know, are the ones like paroxetine, fluoxetine, those kinds of medications that can be very helpful with anxiety. They're technically antidepressants, but they're also very good for anxiety disorders. SUDS, substance use disorders. That's the estimated lifetime prevalence, 8 to 15%, but the same as the general population. Why I put in there it's rarely diagnosed in dental school is because even though the excessive drinking may start in dental school, it doesn't really get picked up though until later. And so, for instance, if I'm looking after a dentist who's maybe been out for 10 years, getting a detailed history from her, she mentions though that actually she thinks her drinking really began to increase while she was a dental student, and at times was drinking sort of quote unquote pathologically. So it's really something to pay attention to. But you're probably trying to sort out, well, how much is normal though? like, but if you find yourself that you're always the one that's starting the party, or you're always the one who doesn't want to leave the party, or you're drinking, quite a lot during the week and none of your dental student peers are, you need to look at that. Those are some drugs that are not uncommon. And prescription drugs, your opiates, remember when you get finished, you have a prescribing license so that you have, and you're around opiates as well as benzos and things like that. So that's what can also put us at risk for self-prescribing, because those drugs are available to us. But once again, very good prognosis for recovery, and there's a lot of research on that of dentists who have had problems. They've got good treatment and monitoring and follow-up, and their rates of cure, if you want to call it that, or certainly sort of recovery are very high. Okay, I want to shift gears now, and I want to talk about being our brothers and sisters keepers. I know this firsthand, actually, from looking after so many people who say that they wouldn't be here today if it weren't for a peer reaching out to them or making a phone call on their behalf to get them into help, just because that they just, were not able to see that. Okay, so here's what you're maybe noticing about a peer. AOB, by the way, is alcohol on breath, and you kind of wonder, this person is different than they were 3 weeks ago or 6 weeks ago. Whatever you do, do something, okay? I mean that very seriously. It's not good to just say, oh, I'm just going to let somebody else take care of that. You're going to speak to the person on a one-on-one, but you can't just jump in and do that. You got to think about it first. You got to prepare what you're going to say. Make a little list of things that you've noticed about that individual's behavior or appearance over the last little while. It could be as few as 3 or 4 things. And kind of, you may even practice this with a colleague because you want to get it right. When you reach out to the person, make sure it's a good time to do that, that it's private. You may want to go outside the dental school or outside their apartment or whatever. And that last bullet, don't preach, judge, or threaten. That's what can happen sometimes, especially if you get pushback from the individual, and you might actually end up getting defensive yourself. In first person singular language, I'm going to illustrate that. Okay, so this is the example of Brad. Okay, so you invite your friend, your colleague Brad, to go for a walk. Using the first, I'd like to talk to you about something. So notice that second sentence, I'm really quite worried about you. So you're, instead of saying you're talking about yourself. I'm really quite worried about you. I've noticed that you don't seem to be your usual self the last few weeks. It seems to me, see what I mean? It's kind of tentative language that you've lost weight, you're quieter than usual, you seem kind of preoccupied and kind of sad. Okay, so that's about 4 things there. That's enough. There could be more things, but don't overwhelm the person. I was just wondering if you're feeling okay. That's an invitational sentence. If I could help in any way, you're offering to help. Now, the vast majority, believe it or not, of people will actually open up to you and welcome. There's this sort of sense that we're crossing a boundary and people aren't going to want to talk, but actually, if you've done this in a kind-hearted and nice way, that individual will open up to you. Okay? Try to get some dialogue going. You might get a better sense of really what's going on. They may be getting some help already, but if you're not comfortable with that and you think you've got some better ideas, well, that'll be the substance of the next slide. But say that because you are kind of wondering if maybe he or she needs a little bit more help than they're actually getting, or certainly, help, period, if they're not getting any help. Now, you may have some ideas of where they can go and get help. You may have the names of people, but sometimes if you just give them the names of a couple of people that you've heard of, or say you yourself are going to a therapist and you found that helpful, that's fine to give them that person's name. But given what I said to you back earlier, when people aren't feeling well, it's awfully hard to make those phone calls because you don't feel good about yourself and you can feel that you're bothering the person. Or you don't even have the energy. So it's not a bad idea for you to offer or volunteer to make the call yourself and set it up. I get lots of calls like that at the hospital now where I work. And I supervise the psychologists who look after the medical students. They get medical students calling on behalf of somebody else. They say, I'm calling, my roommate is open to seeing you, but she can't make the phone call. Will you see her? And the psychologist says, of course. And bring her over if you can, and just wait in the waiting room. That will make it easier. And it does. As it says there, that will ease the journey. Okay? If the person really wants to do it himself, as Brad seemed to want to do, make sure you check back in a day or two to see, though, if they have indeed made that appointment. Okay. This is the tough one. Brad tells you to get lost. Please don't take it personally. It could be what we call diagnostic, that he could be quite ill. He's really, really defensive. He may have quite a serious illness going on. There could be alcohol or drugs. It could be a severe depression. You could have bipolar illness. There's all kinds of things that could be happening. And it's way beyond, your level or expertise as a peer, as a fellow dental student. Okay? But the main thing is, though, is that you've tried, you picked up something, and what's more important is to get resources that would be available to you at your local dental school. Or you start, asking around either preceptors, or perhaps you go to the dean's office or something to get some guidance with regard to next steps. Okay? All right. And those are some resources right there. And the first one, of course, is what we're doing tonight. And the American Dental Association also has a section on wellness, the student counseling. Okay. We're getting toward the end of this now, and I want to focus on the suicidal dental student and whether or not that could be going on because it's so serious. It's rare, but as you know, we're talking about a life and death situation. Here in New York City, when you ride the train, I ride the train every day to work, and the Homeland Security messaging is all over the subway. If you see something, say something, okay? It is a myth that you can make somebody suicidal if you ask them, so get that out of your head. But it is a fact that reaching out to someone who may be suicidal prevents self-harm and saves lives. There's just so much research on that and so many voices of people who will say that. Even when it's a complete stranger who reaches out to somebody, you can save a life. And I've always been of the school of thought, I would rather overcall, overreact than ignore or dismiss. Now, I'm going to show you now about a 4-minute video. It was made for medical students and for residents in various medical specialties, but it's really applicable to dentistry as well. And it basically is what I mentioned earlier, in a way of sort of understanding the stresses that people can be under and how to reach out for them. So if you give me a moment, I'm just going to set this up.
Medical training is challenging.
It can be frustrating.
Exhausting.
Overwhelming. Especially when things pile up on you.
My marriage is coming apart. I took out $183,000 in loans.
I made a mistake. Bad one. Sometimes I feel like I'm in over my head. I just don't feel prepared.
Sometimes afraid to ask straight out, are you feeling so bad? You're thinking about taking your life? People want someone to ask. They want someone to care. Faculty, peers, friends, anyone can ask.
Are you thinking about killing yourself?
And if she says yes, or maybe, or sometimes, here's what you don't say.
That's great. One mistake isn't worth killing yourself over. That's not going to solve anything.
What you do say is, I'm sorry you're feeling so bad. How can I help?
We'll get through this together. Let's get you some help.
Assume you're the only one. You'll reach out and get this person the help she needs.
None of us should be ashamed of getting help.
Getting help is the strong, professional thing to do. Let her know she has options, but there are people she can talk to.
Let her know she can always turn to you. Make sure she has the National Suicide Lifeline number.
And help her find someone she can talk to. Someone who knows how to help.
Ask the Dean for Student Affairs or the Program Director.
If you think she's about to hurt herself, don't leave her alone.
Take her to the emergency room. Call 911 if you have to.
We all get down. We all have our bad days. But sometimes it's more than that.
If you think something's wrong, the only way to find out is to ask.
Are you thinking about ending your life? Don't wait until you're sure. Trust your gut.
It never hurts to ask. It never hurts to care. It can make a big difference.
Any one of us can make a difference.
All the difference.
In someone's life.
Okay. As you can see, that's a very powerful 4 minutes. It's on YouTube, and I urge you to maybe look at it again sometime as a group, a small group of you. That's why I put this slide together, to just kind of summarize some of the key messages that come out of that short video. First of all, what it does, it tells you what training can feel like. And then I just listed some of the stressors they mentioned. The woman says, my marriage is coming apart. One man's got big loans. I made a mistake. Like, he's referring to a mistake that was made in the workplace, like a medical error, in your case, a dental error. Sometimes I feel I'm in over my head, not prepared. The real mistake was that I thought I could be a doctor, et cetera. See, that's the sense of fraudulence or imposter syndrome. Then they list the symptoms and signs of burnout, depression, suicidal behavior. This is important, that this can happen to us. It can happen to high-achieving people. We're human too. Higher rates in medical students and physicians, what to say and what not to say. But this is very important. We'll get through this together. First person plural. We will get through this together. And getting help is the smart thing to do. It's the professional thing to do. It's not weakness. It's the smart thing to do. And then, of course, the 1-800 number for suicide crisis line. But those are some very important messages. Okay. Let me finish up now with some strategies and suggestions and some take-home messages. Prioritize your time as best you can, if you can be organized, so that you've got time in your life for things other than dentistry. Your friendships are extremely important. You're going to be busy, but yet try to still see your friends, call your friends, etc. Your loved ones also are going to want to need to see you. Exercise, again, you got to be organized to keep that up. Appetite, etc. Relaxing. Good sleep hygiene, very important. Make sure that you get plenty of it as best you can. Fight the stigma associated with feeling unwell and seeking professional help. One thing I can tell you, and I'm not exactly sure in the world of dentistry, but certainly whenever I read a first-person account that's written by a medical student or a physician in the medical journals or in the lay press of an individual who's gone public and they told their story, I always send them an email. I do that because I want to thank them for telling their story. Because when they do that, they are easing the journey for other people, and they were really chipping away at stigma. Because I don't know what it is, but obviously there's stigma in our society about psychiatric illness, but it's really quite high in the medical and dental professions. It's seen as, we judge ourselves and others that it's weakness or something when it's just got to do with everything else in life. So there's still that stigma. So when somebody goes public with it, that's a real gift. And they're courageous, and I want to thank them. So I urge you to do the same thing. If you have friends and colleagues who actually speak openly about the treatment they've received, thank them too. Get a primary care physician. A lot of people don't. And there's a lot of things you can read about. There's so much stuff online, and there'll be stuff offered at your schools as well. Mindfulness-based stress reduction, meditation really, really works. A lot of people do that and find it very helpful. Yoga, don't isolate, be kind to each other, and pay attention to the role of spirituality and or religion in your life. That can really be an important dimension too. Take home messages, take care of yourself, take care of each other. And this is basically just a reminder, if you're not feeling well, go talk to someone. You could start with your spouse or partner, see if they validate it. It could be a friend, your training director, a mentor, et cetera, all the way into getting professional help. Dental training can be stressful. As you say, we're human too. Subject of same curveballs and illnesses that befall our patients. Perfectionism again. It really is a relief to talk to somebody to trust. Again, any of you who have done that, any of you who have had counseling, therapy, or whatever will know how good it feels to just get stuff off your chest and to not be judged, and to also sometimes get sort of a reframing of that by a trained professional, that they can pick up things that we can't see ourselves. And that can really boost your spirits. It can also boost your self-esteem as well. So psychotherapy counseling can be really, really valuable. So this is my thank you slide. Also, that's my email. That's my website, my office number. And as Cassie mentioned at the beginning, I'm open to, well, it's 9:18. We've got time for some questions. And also, if any of you want to get in touch with me with regard to that. So thank you, everybody, for your attention to this.
Oh, I apologize. I believe my phone was muted. For those of you who have questions, I encourage you to type them into the box on the screen, and I'll read them to Dr. Myers. In addition, if you have a question that you prefer to ask privately, as Dr. Myers mentioned, you can send him an email at that address on the screen. We do have a few minutes, and we'll gladly stay on and take any questions that anyone has. I'm giving everyone an opportunity to type and share their questions if they have them. All right. It doesn't look like we're having any questions right now. I do encourage you to send them in via email if you have them. We'll wait a few more minutes here. I would like to, at this point, also thank, I'd like to thank our sponsor, and that's Great West Financial, who is the sponsor of ASDA's Wellness Initiative for the coming year. It looks like we don't have any questions tonight, Dr. Myers. We're going to go ahead and finish up. If you had a closing remark.
I would just like to thank everybody for coming on the webinar tonight, and any of you who will be sort of looking at this online. And I wish everybody well. Take good care of yourselves and each other, and thank you for the opportunity to talk with you.
Thank you so much. I'd also like to thank everyone who joined us and participated in tonight's program. And just one final housekeeping note, that you will receive an email survey in an hour or so. Please take just 3 or 4 minutes. Let us know what you thought about the presentation tonight and any other topics you'd like ASDA to present on future webinars. This program was being recorded and it will be posted on ASDA's website and the YouTube channel by the end of the week. I'd like to thank you again and wish you all a good night.